Well, the Volunteers of America North Louisiana Epicenter is the first and only place in Northwest Louisiana that offers psychosis specialty care and serious mental health counseling in our 9-parish area. Today, we're joined by Crystal Poland from the Volunteers of America to tell us more about the care they provide through the Epicenter program. Crystal, nice to meet you. Thanks for coming in.
Thanks for having us, Jeff. I enjoy being here. Thank you.
Yes. Well, tell us a little bit about, there are 3 phases of care. Let's start with the first one, which is emerging care. What does that exactly involve?
Well, in our emerging phase, we can see one of any 2 types of clients. One can come in already having a mental health diagnosis, but they haven't been linked to community care, a community provider to provide those therapies, their medication management, case management, whatever they need. We can do that for them. The second type of client that we see are clients that may not have a diagnosis at all and need to be screened to see what type of mental health condition they may have. They're newly experiencing symptoms, maybe some depression, some sadness, anxiety, trauma may be resurfacing, grief, and they're just not sure that, you know, what to do with all of this. So they can come to us, we can help get them screened and get them an appropriate diagnosis. And from there, we can let them know all of our treatment options and we can make recommendations of what we think is a good fit for them and collaborate with them and their family and their support system to figure out what's best for them.
Okay, let's talk about the second phase, which is active care. What's that all about?
Okay, so our active phase is a little bit more robust, right? So these are our folks that actively have a mental health condition, and sometimes it's getting in the way of their daily functioning. So they're having trouble sometimes eating, sleeping. It can extend to their relationships with family members, loved ones, significant others, and even their work in school. Sometimes they have difficulty maintaining a job or obtaining work because these mental health conditions are just getting in the way of them being able to function as they need to. So what we do is we pretty much tailor make treatment for them through a combination of individual family psychotherapy, medication management, and psychiatric consultation, case management. We also offer supported employment and education services, which is something that really kind of sets us apart because we're able to provide them with getting help finding work, interviewing skills, some of the basic skills that they don't have. And we also just tailor make it to whatever them and their family needs. We offer multi-family group to the families as well, because a lot of the times the families have a really hard time accepting the client's diagnosis, especially when it's psychosis related. Because remember, with psychosis, sometimes people see things or hear things that's not really there, or they have beliefs that aren't rooted in reality. So it's really hard for family and loved ones to understand that, so we provide them the support as well.
All right, if you could just tell us a little bit about the third phase, which is the recovery care.
So recovery is one of my favorite phases because we've reached a level of stability. We found out what meds work, what series of treatments work, and now it's just a matter of just keeping them on a straight and narrow path. We figure out, okay, what do they continue to need? We make sure they have firm safety plans in place, because ultimately our goal is to keep everyone out the hospital, out of jail, keep them housed, keep them on a job, and really whatever their goals are. So that recovery phase also adds in some group services, and we'll be expanding to have 3 group offerings in the new year so that they can have that sense of community and they can also learn skills, and the different offerings will allow them to attend group at their pace and then on their schedule.
And there's also an outreach service that's a part of the Epicenter. How does that exactly work?
So that's my job. So I'm the outreach manager, and my job is to pretty much do things like this, let our community know that we're here, and also to help reduce the stigma around mental health services. We offer trainings. I do a psychosis in our community training that anyone, any agency or organization in the community, I'm willing and able to come and train for as short as an hour. I can do a 2-hour training as well, and just help people who are coming in contact with folks with mental health disorders and psychosis in particular to not be afraid. It's something that we don't always have a lot of education on, especially if you don't have someone like that in your life, but we can and we do come in contact with these folks. So it's good to know how to be safe and how to know where to send them to refer them to, because they can send them to the Epicenter.
Right. Well, Crystal, who's eligible for this program?
So anyone 18 and up and who are looking for someone in the community to partner with for their mental health, if they're ready and willing, anyone 18 and up who are Medicaid recipients, we're able to take them at this time. We are accepting new referrals, and referrals they can either call our office or contact us on our website.
There's so much more effort being put into mental illness now than there was years ago. Not that people didn't have issues, but they just didn't know about it. And it really is helping people, and programs like this, because you're seeing people at all ages of life struggle with it, and it's got to be addressed, you know?
Yes, absolutely. At Volunteers of America, we have a long history of really being committed to mental health. Our Visions of Hope program runs our day groups, so we have folks on a daily basis getting those services, and our clinicians are out in the community. In DeSoto Parish, we have an exclusive school-based program where we're in the schools providing those therapies so that this generation's kids are exposed to therapy, and they do understand that mental health is just as important as their physical health. And that's the message that we're really trying to relay out there, is mental health is important, and we are here at Volunteers of America, North Louisiana, ready to serve. All
right, Crystal, so nice to meet you, and thanks for the great information on this program.
Absolutely. Please check out our website, www.voanorthla.org. Go to Behavioral Health for all of our information and programming.
All right, thanks so much.
Thanks, Jeff.
You bet.
Have a good one.